Hi, I'm Siffat, and for this Student Symposium presentation, I will share our findings from a literature review on youth experiencing homelessness and text messaging interventions. An interdisciplinary team of 6 students, both undergraduate and graduate, conducted this literature review. We would also like to thank 2 additional students for their contributions. Here is an overview for this video presentation. Before we get started, it is important to operationally define what we mean by homelessness and text messaging, and as well as text messaging interventions, or what we will refer to in this presentation as TMIs. We used a systematic literature review approach, guided by the following research questions. We conducted our literature searches in both EBSCO and Google Scholar. We reviewed up to the first 100 articles for each search. And we also found 8 additional articles via citation mining within the initial 24 articles we discovered, giving us a total of 32 articles for this literature review. We read each of the gathered articles and summarized them into a table. We then conducted both content analysis and a thematic analysis using an open coding process on the data gathered from these articles. From our analysis, we identified the following findings. The articles we settled upon used a variety of approaches. 28 of those 32 articles were empirical studies, and 25 of them were conducted within the United States, with highest percentage of US studies coming from the West. The TMIs mostly focused on 4 kinds of programs: mental health, drug cessation, HIV prevention, and pregnant and parenting youth programs. The research conducted on TMIs for youth experiencing homelessness provides several important findings related to technology access, program retention, engagement, and usage. For instance, the majority of the youth experiencing homelessness owned or had access to a cell phone or texting technology. The retention rates of youth experiencing homelessness within their intervention programs range from 63% to 90%. Youth are regular users of text messaging features on cell phones, which makes it a beneficial communication vehicle. Involving youth in the intervention design process from the start may be especially important for underserved populations such as youth experiencing homelessness to ensure that developed tools truly meet their needs. It is important to be aware that youth shelters or their work location may have restrictions on cell phone use. Such restrictions can interfere with program participation. Research interventions that include the provision of cell phones to youth should also provide paid phones and texting services for the duration of the study if they want to achieve optimal retention. However, be sure to have a backup contact method because the phones may be lost, given away, damaged, or stolen. Youth experiencing homelessness face unique challenges. Effective use of novel strategies like TMIs can be one possible way of engaging youth experiencing homelessness in health-related programs. To learn more about Center for Program Evaluation, visit the following. Thank you for listening.